In this explainer, we're going to explore how artificial intelligence is really transforming practices for all kinds of medical professionals. We're talking doctors, physiotherapists, psychologists, coaches, you name it. And this goes way beyond just simple administration. AI is becoming a core therapeutic tool. So here's how we'll break it down. First, we'll look at practice management, how AI is crushing the admin burden. Then we'll get into its role as a therapeutic tool. And finally, we'll cover the really important stuff, the legal and practical side of getting this up and running.
All right, let's dive right in. The most immediate and honestly one of the biggest impacts of AI is in tackling that huge time suck for any provider, all the paperwork and administration.
And this isn't some isolated case. This is becoming the new normal. We have AI tools now that are specifically trained on medical language, and they're handling complex documentation with an efficiency that was, frankly, unimaginable just a couple of years ago.
So when you see a number like 95%, what does that really mean? Well, it's not just a statistic. It represents a massive shift in the daily workflow. We're talking about freeing up hours every single day for what actually matters, which is direct patient care.
And the process itself, it's surprisingly simple. You'd think it would be complicated, but it's not. Tools like Plain Voice for psychotherapy or artsbrief.ai for medical reports all follow this super elegant 3-step workflow. It basically turns hours of typing into just a few minutes of review.
When you put it side by side, the contrast is just night and day. On one hand, you've got this constant state of fragmented attention and admin overload. And on the other, you have this streamlined practice where technology handles all the tedious stuff, letting providers be 100% present with their patients. Okay, so that's the admin side. But this is where things get really interesting. AI is evolving way beyond just being a scribe. It's becoming more like a co-pilot, one that's actively involved in the therapeutic and diagnostic process.
I mean, this is so much more than just taking notes. In coaching, for instance, AIs are now analyzing session transcripts to pick up on really subtle communication patterns, and they're helping to map out strategic development for clients. It can even act as a sparring partner to practice, say, a tough negotiation. It's pretty incredible.
Or think about physiotherapy. This is a total game changer. All of a sudden, a patient has a tool at home that can give them precise, continuous feedback on their exercises. This makes treatment way more accessible and consistent, and of course, more effective, especially between in-person visits.
And even in hands-on fields like massage therapy, the vision isn't about replacement, it's about collaboration. You can imagine machines that provide tireless, precise mechanical work, while the human therapist brings that essential intuition, emotional intelligence, and holistic view that, let's be honest, technology just can't replicate. All right, so we've seen all this amazing potential, but now for the reality check. How do you actually bring these tools into a practice safely, legally, and in a way that's financially viable?
Okay, this is absolutely crucial. According to data protection authorities, choosing your system architecture is a fundamental decision. Closed systems give you so much more security and control over sensitive patient data. It means what happens in your practice stays in your practice. It doesn't get used to train some big global model.
And here's the bottom line. Using AI doesn't get you off the hook when it comes to responsibility. If anything, it heightens it. This all requires a really structured, proactive approach to data governance. The provider is still the data controller, and they're the one accountable for compliance with regulations like GDPR, or, for example, DSGVO in Germany. Now, the good news here is that the mature solutions out there are actually built with these legal requirements baked right in. They offer essential features like zero audio data retention after they're done with transcription and automatic anonymization of personal details, things that are absolutely non-negotiable for clinical use. Which, of course, brings us to the practical question, how do you pay for all this? Well, there are concrete pathways. For instance, programs like the KfW promotional loan in Germany are making these advanced tools much more accessible. These loans can cover pretty much everything, from the hardware to the AI software itself, and even the training your team needs to use it effectively. So, when you step back and look at the whole picture, the takeaway is really clear. AI is making a huge transition right before our eyes. It's moving from being just an administrative assistant to becoming a truly integrated professional partner for healthcare providers.